This is your most awaited video, kidney cysts. We're going to be talking about kidney cysts, treatment of kidney cysts, types of kidney cysts, causes of kidney cysts, what you will do when you notice you have kidney cysts, symptoms of kidney cysts, because a lot of you may be having kidney cysts and you're not even aware that you're having kidney cysts. So let's get to it. My name is Nurse Merit. I'm a nephrology nurse, basically dialysis. Kidney is my specialty. I'm also a naturopathic medicine student trying to find natural ways for healing. If you have more questions, put them in the comment section. If you want to have a one-on-one consultation with me, you want us to prepare herbs for you that can help diabetes, high blood pressure, kidney cysts, kidney stones, cholesterol, prostate, infertility, just chat the number on the screen and book consultation with us or with a healthcare provider who can get you a doctor or anything you want. Sorry about that long introduction. Alright, so let's get to it. So kidney cysts basically means fluid-filled sacs in your cysts, in your kidneys. So take for instance when there's hot water on your skin, hot water pours you on your skin, and when it happens, you will see some, the skin around that place will be filled with fluids. Okay, so this happens in the kidneys sometimes. So, but there are different types. There is one that you don't need to be scared, but there are ones that you need to be scared. All right, so let's get to it. Number one, we have a simple cyst. So most people have simple cysts. Okay, sometimes you even find out unconventionally, like you just went for your scan for something else and they now say they are seeing cysts. So usually this kind of cyst does not have any issues. It is uncomplicated, no septal, no defect, no calcification, nothing, no hair like. It's just simple and it's little. Okay, one or two cysts. Okay, this is absolutely normal. However, you have to be very careful, so you have to continue to do scans, do follow-ups 6 months, 12, maybe once in a year or twice in a year to check how far is it growing big or not, and of course pray about this. Okay, I'll be telling you what to do at the later end of this video for every kind of cyst. So the next one we'll have is the complicated cyst. Okay, so this could be also, it can come in simple form. So it could be simple, in a simple form where there is nothing, or there will be calcifications, septations, there will be hair-like, some hair. Sometimes if this is your radiologist now, your doctor will be able to classify the kind of cyst that you have, okay, and your nephrologist. So this kind of cyst could be cancerous, some may not be cancerous, so you also need to know the kind of cyst that you have. Okay, so this kind of cysts, some can be removed through surgery, draining the liquid out through surgery. It can be 1, 2, or 3, but it depends on what it is. So make sure that when they say you have cysts, make sure you find out the kind of cyst you have so that you know what to do. Sometimes, and you also need to be monitoring it to see what is going on. So you need follow up with your urologist or with your doctor all of the time. So the next one we'll have is the acquired cyst, okay, which is usually seen with people that have kidney failure that are on dialysis. So usually after how many years of dialysis, so many years of dialysis, we find out that these people start developing cysts. The dialysis has a way of making most people on dialysis for a very long time, in years, they can develop this kind of cases. Then we'll have the last one. There's another one too, but it's not relevant. We'll have this one. It's called polycystic kidney disease. So this is a kind of cyst where there is a lot of cyst in your kidneys. It's usually genetic. Okay, there is dominant and there is recessive, so you can pass it to your child. So this is very important now. So this type, there's actually no cure. Okay, there's nothing you can do about it, and early management is better, so that, because when the cyst takes over the whole kidneys, the person, the kidneys will fail, and the next thing is dialysis or kidney transplant. So that's why I say when you have simple cysts, so you have to be going to check, because that simple cyst may actually be a polycystic kidney. Maybe the next time you check, you will now see that the cyst is all over the place. But if you just relax and say, this is a simple cyst, you never can tell what is going on. So polycystic kidney is genetic, and a lot of people have it. So if you have it, just know that your child may likely have it. So this you should be aware of. So now, what are the symptoms that you may have cyst? So we have flank pain, your sides are paining you. It could be ulcer. This is just a general, symptoms. If you add it up with other symptoms I'll be mentioning, blood in your urine, painful urination, severe flank pain, and so many other things can show that you'll be having some kidney involvement. Then what do you now do when you notice that you have this cyst? It depends on the cyst you have. I've already mentioned what you have to do. The complex cyst, if it's cancerous, it can be removed, depends, or they can non-cancerous, or if the cyst is becoming bigger, they can aspirate with syringe. That's what the urologist and the nephrologist will do. However, these are the general things that you can do. Number one, make sure that your blood sugar level is controlled, your BP is controlled. These two things, if they are seriously deranged, they will be causing more, they will be making the kidneys to fail. So please, if you find it difficult to control these two things, you can reach out to us via the number on the screen. To either talk to a doctor or a nephrologist, or you can consult with me. I can also help you with natural remedies that you can use. So the next one is that you have to, your food, use food rich in antioxidants. Now, depending on your kidney, your GFR. Remember, we have videos on GFR, kidney, your kidneys. Sorry. So your GFR, you can eat mushroom, right? Take a mushroom. This is good for your kidneys. It can help build your immune system. And then you can reduce your salt intake. Very important. Please don't eat food high in salt. Highly processed food, really avoid them. Canned food, coke, beverages, sweet drinks, all of those drink alcohol, you have to wash them out of your diet. Make sure that you are doing exercise so that the kidney will have a lot of blood supply to it. Okay, then drink lots of water depending on your kidney capacity. Now, if you're on CKD, remember that if you're in CKD, your water has to be metered, okay? But however, if your kidneys are still fine, please drink a lot of water to help flush. Then detox your kidneys, okay? Once in a while, maybe once a month or twice a month. I've taught us how to do that. I'll still be doing more videos on that. Eat more of vegetables, pumpkin leaf, ugu, cabbage, cauliflower, bleach it, vegetables, red, green, yellow peppers. They are very good for you. Berries are good for strawberry, raspberry, blueberries. They are very good for you. They have a lot of antioxidants. They are good for your kidneys. They help detoxify your kidneys. Garlic, ginger, turmeric, a little bit of turmeric. These are very good for your kidneys. So incorporate them in your kidneys. Then we'll have the herbs. Dandelion in smaller quantities, moringa in smaller quantities, astragalus. Basically, we can help you prepare a kidney detox, okay? Depending. So if you're ordering kidney detox from us, or if you're having anything, you're having protein in your urine, make sure you signify. Or if you just want to detox your kidneys, make sure you signify that you don't have any kidney issues, so that we'll know the strength to put for you, okay? So I think this is the end of the video. I'll do a physical recipe, showing you how to prepare some of these things, okay? I think I'll do it after this video. The second video, the next video will be how to do some of these recipes. So if you have any question, you want me to do any video for you, just put it on the comment section. Like this video, share and follow for more. Have a nice day. Make sure you subscribe. Remember, if you want to have a conversation with us, chat the number on the screen. Bye.